So I'd like to talk a little bit about the treatment of anxiety. My own personal bias is that if you understand how anxiety works and how to respond to a person who's experiencing anxiety, that knowledge will translate into so many other areas of your work. Working with clients who are depressed, they're often plagued by fears and worries that are part of their depression. If you're working with clients with personality disorders, so much of a personality disorder can be driven by a person's anxiety, or certainly in terms of how it expresses itself. Clients who have experienced trauma. Trauma usually is an anxiety response to a person's sort of feared events and the return to a previous event that's troubled them. Anger, of course, is very similar to anxiety. In fact, in some ways, anger is the flip side of anxiety. Some individuals, when they're under threat, respond with fear. Other individuals respond with aggression. So they're very closely linked into terms how they work. Substance use. Clients are often using a substance because they have anxiety. Alcohol is often referred to as liquid courage, right? And so it becomes a way to cope with a person's sort of fears and anxiety. Interpersonal conflict is often very much related to anxiety. So having a solid understanding of anxiety, how it works, and strategies that you can use, I think will serve you well in whatever kind of environment that you work in. Now, I think one of the first places to start when we work with an individual with anxiety is just giving them information about what anxiety is. Many times the problem that an individual has with anxiety isn't so much that they are anxious, but more that they're afraid of experiencing anxiety. They don't like being anxious, and they don't like that experience. So much of what they're doing behaviorally that's interfering with their ability to function in life is avoiding situations where they're going to feel anxious. So giving people information about anxiety is really important. Consider individuals who like to take roller coaster rides. What are they doing when they go on a roller coaster? They're experiencing fear. And yet they pay money to have that experience. Compared to our clients who live in fear of having anxiety, they're engaging in a lot of behaviors both internally in their head and also externally to avoid that experience of anxiety. Giving information, therefore, can go a long ways. I like some of this stuff related to the fight or flight response, or fight, flight, or freeze response. Freeze is actually probably most common with anxiety. And so understanding why their body's doing what they're doing, and specifically that their body is built to handle this physiological response of anxiety. Your body is built to handle it, and it's not going to hurt you because you experience anxiety and because you have all this physiological response. So you want to normalize the response through the provision of information. If you're working in a setting like an emergency room or where you have brief contact with individuals, you can do very small pieces of information giving that can go a long way to helping a person understand what's going on with their anxiety. In terms of the cognitions related to anxiety, there's two main themes that people experience. One is overestimating the risk that they're in. They're worrying and going over in their head about some catastrophic possibility, that something that could happen to them. And so they're overestimating the likelihood of that catastrophic event. Parallel to that, they may be underestimating their ability to cope with that event, or underestimating the resources they have at their disposal to handle that event if it were to occur. So if you're worrying about an event, one of the strategies is to look at, okay, if that were to happen, how would you handle it? How could you cope with it? So in terms of cognition, we have these two themes going on with individuals that have high anxiety: overestimating the risk and underestimating their ability and the resources at their disposal to handle that risk if it were to happen. When I work with individuals with high anxiety, I like to focus on three main themes. One is learn to relax. Okay? So when your anxiety level is going up, how do you turn it down? How do you tone down the level of physiological response? So things like relaxation exercises or mindfulness meditation are always helpful for individuals. The second theme is the cognitive theme, keeping things in perspective. So providing clients with information and helping them evaluate their interpretations of situations. The third strategy or set of strategies is what I say to clients is facing your fears. This is where you look your fear directly in the face and you do things where you challenge your limits and challenge your fears by actually doing it. So technically we refer to this as exposure therapy, where you engage in often a hierarchy of exposure to events that are feared. One of the traps that clinicians get into is they focus primarily on the strategies that are around relaxation, helping a client feel more comfortable in a stressful situation. But the reality is that if you don't work with a client around what they're afraid of and what they're avoiding, they'll never get over their fear. Part of what has to happen for an individual is they face the thing that they're afraid of, their anxiety level goes up, but then they learn that they can survive that higher level of anxiety. And if they stay in the situation long enough, their anxiety level will drop. And so the basic sort of exposure exercises that help a person face their fears are probably the most important thing that you can do with an individual who is experiencing anxiety. Often clients with anxiety, they understand the problem in their thinking, they understand that they're worrying about things that they shouldn't be worrying about. But it's not until they actually put themselves in the situations that they're fearful of that they discover that they can cope. And then that behavioral action seems to have more effect on changing their thinking. So that becomes kind of one of the important things. Anyways, I think working with clients with anxiety is something that you're going to experience wherever you go, and understanding the dynamics of treatment around anxiety is highly transferable to a lot of different kinds of situations.